Hello, and thank you for joining us for this very special World Elder Abuse Awareness Day 2024 Facebook premiere event. I'm Jessica McCowan, Missouri Adult Protective Services Outreach Coordinator. I'll be your moderator for today's discussion. June 15th marks a very special day, World Elder Abuse Awareness Day. This is a global awareness day officially introduced by the International Network for the Prevention of Elder Abuse and the World Health Organization at the United Nations on this day in 2006. This important day is in support of the United Nations International Plan of Action, which recognizes the significance of elder abuse as a public health and human rights issue. It is observed every year to provide an opportunity for communities around the world to promote a better understanding and increase awareness of the cultural, social, economic, and demographic processes affecting elder abuse and neglect. We know that no community or country in the world is immune from the mistreatment of older adults. The color purple has been adopted as a symbol to raise awareness of adult abuse and the effects of abuse, neglect, bullying, and exploitation in later life. Each year, we are asked to wear the color purple on June 15th to show our support in the worldwide effort to prevent elder abuse. Today, we have a very special panel discussion to help us not only recognize our 2024 World Elder Abuse Awareness Day, but also have a timely discussion about our efforts here in Missouri to ensure older adults are protected and safe from adult neglect, abuse, bullying, and exploitation. I'm honored to be joined by the esteemed panel, all wearing purple today: Melanie Highland, Steve Bolin, Tim Jackson, Christy Seiler, and Jerry Green. Welcome to each of you. If you don't mind, I'd like for you all to give a brief introduction about yourself, starting with Miss Melanie Highland.
Hello, my name is Melanie Highland, and I'm the director of our Division of Senior and Disability Services.
Thank you, Melanie. Steve?
Hi, I'm Steve Bolin. I'm the Division Director for the Division of Regulation and Licensure with the Department of Health and Senior Services.
Thanks for joining us today, Steve. Mr. Tim Jackson.
Hi, I'm Tim Jackson. I'm a section administrator over Adult Protective Services inside of the Division of Senior and Disability Services.
Good to see you again, Tim. Miss Christy Seiler.
Hi, I'm Christy Seiler, and I'm the Bureau Chief for our Adult Protective Services Field Staff Unit.
Thanks for joining us today. And Mr. Jerry Green.
Hello all, I am Jerry Green. I am the Unit Chief in the Office of Special Investigations in the Department of Health and Senior Services.
Thank you. Let's go ahead and start with Melanie if we can. Could you tell us how the Division of Senior and Disability Services addresses elder abuse in Missouri?
Sure. The Division of Senior and Disability Services, DSDS, serves as the State Unit on Aging and is the primary state agency that oversees, monitors, and assures the health and safety of Missourians as we age, regardless of abilities. Our unique mission is to protect, support, and empower seniors and individuals with disabilities through assessment and connection to community resources to age with dignity. The division operates the Central Registry Hotline, which is available 365 days per year from 7 a.m. to 8 p.m. and includes an online reporting option available 24 hours a day. Reports of alleged abuse, neglect, or financial exploitation of persons age 60 and older and adults with disabilities between the ages of 18 and 59 who may not be able to protect their own interests can be made via the toll-free hotline number at 800-392-0210 or online at health.mo.gov/abuse. Our staff investigate hotline reports and coordinate short-term intervention services for individuals to remain in the least restrictive environment of their choice and prevent future incidents. This work can include the assistance of department attorneys when seeking guardians or conservators for reported adults. In addition, the Office of Special Investigations may conduct criminal investigations alongside law enforcement and prosecuting attorneys when reports involve a possible criminal component. Our division staff can also provide resource referrals, even if they don't need to investigate. Some people may be reluctant to call the hotline if they are not sure that it is a situation which can be investigated. Knowing our staff are there to guide seniors and individuals with disabilities to resources in their community may encourage them to make that call.
And why is World Elder Abuse Awareness Day so important to the division?
Well, it gives us a really great opportunity to raise public awareness about the prevalence and effects of abuse, neglect, and exploitation on older adults, and shine a light on the great work that our staff do to protect vulnerable adults here in Missouri.
Abuse and neglect of older adults doesn't just happen to those who live in the community. Steve, can you tell us how the Division of Regulations and Licensure helps to combat elder abuse in facilities?
Sure, Jessica. The Division of Regulation and Licensure regularly inspects licensed facilities to ensure compliance with state and federal standards. Long-term facilities include skilled nursing, assisted living, residential, and intermediate care facilities. There are approximately 1,165 long-term care facilities across the state with more than 81,100 beds that are licensed and inspected by the Section for Long-Term Care Regulation. Our DRL staff, they also investigate allegations of abuse, neglect, exploitation that occur within those licensed facilities. DRL surveyors have investigated a total of 2,561 reports in fiscal year 24 thus far involving allegations of abuse or neglect of residents of long-term care facilities. The facilities have self-reported themselves so far this year about 1,410 times. And then we also use our family care safety registry to assist long-term care facilities with obtaining background checks on potential long-term care facility employees. The goal is to ensure that only the safest and most caring individuals are hired to provide care for our older residents.
And tell us why World Elder Abuse Awareness Day is so important to the Division of Regulations and Licensure.
Sure. So our role is to ensure quality care and safety at our long-term care facilities in Missouri. World Elder Abuse Awareness Day helps to highlight the critical role that our surveyors play in identifying where care does not meet standards. We don't just regulate facilities for the sake of regulation. The end goal is to ensure that our older residents get the best care possible.
Thank you.
Sure.
So now that we know that the department's role in investigating elder abuse, Christy, can you please tell us about the leading causes of elder abuse?
Sure, Jessica. As many people age, it can become increasingly difficult for them to stay involved and connected in their communities and with their families. As a result, older people are more likely to experience social isolation, which increases the likelihood of abuse, neglect, and exploitation. Elder abuse affects older adults across all socioeconomic groups, cultures, and races. Abuse can occur anywhere, especially when they are disconnected from their family and other social supports. Isolation is not just in someone's home. As Steve mentioned, it can also occur in nursing homes, assisted living facilities, and other institutional settings. Isolation can even occur in hospitals. While any older person is potentially at risk of elder abuse, we know that some are more susceptible to experience abuse and neglect more so than others. Based on available information that we have, women and people over the age of 80 are more likely to experience abuse. Factors such as dementia, poor physical health can increase the likelihood of someone becoming isolated, which in turn puts them at greater risk of experiencing abuse and neglect. Some other common factors could also be mental health, substance abuse issues, and poor physical health.
Well, thank you for that information. Tim, I understand the National Center of Elder Abuse estimates 1 in 10 adults age 60 and over in the U.S. have experienced some form of abuse in the prior year. Some estimates range as high as 5 million elders are abused each year. But just how prevalent is adult abuse in Missouri?
Sure. In Missouri, during fiscal year 2023, The Department of Health and Senior Services received and investigated 43,862 reports of abuse, neglect, bullying, and exploitation involving seniors and adults with disabilities living either in the community and in facilities. That amounts to an average of about 120 reports each day. Self-neglect represents 42% of all the allegations for fiscal year 23. Nearly 75% of victims are 60 and older. About 59% of our victims were females. 36% of victims were reported to have lived alone, with a further 25% living with a relative.
Wow, is this an increase of the reports received over last year?
Yes, there is a slight increase in reports from last year. Over the last 14 years, we have averaged nearly a 1% increase in reports per fiscal year. Even with the steady increase, the extent of the problem is still vastly understated because the victim often has an emotional bond with the perpetrator. Seniors may be socially isolated and physically dependent on the perpetrator, who is often a son, a daughter, or a caregiver, making it nearly impossible for them to report for fear of losing their last vestige of independence. The National Center on Elder Abuse estimates for every case of elder abuse or neglect that's reported to the authorities, as many as 23 cases goes unreported.
Christy, now that we know just how big of a problem elder abuse is here in Missouri, what can we do to help address and prevent it?
So, Jessica, there are many ways for everyone in the community to get involved. But the biggest thing is really for us to create a society that safeguards our communities and prevents elder abuse from even occurring in the first place. But first, we as a society, we need to talk more about the issue of elder abuse as we are today. We need to raise public awareness about how to identify abuse and how to report it. We need to provide older people who experience abuse with a safe environment to speak out and to tell their stories. We need to challenge injustice and ageist stereotypes. We need to develop enhanced services for older people who have experienced abuse, services that are targeted to prevent abuse and to reduce isolation amongst our seniors. We need shelters and other supportive services specifically designed for older people who have been abused and who need to leave dangerous situations. We need to improve training amongst our own adult protective services staff so they are better prepared to respond to the increasing number of reports of elder abuse. But also we need to continue improving education for mandated reporters. What are the risk factors and red flags of abuse and how to appropriately respond? Lastly, I would like to encourage everyone to keep in contact and to talk with your older friends, neighbors, and relatives, to always be aware and alert for the possibility of abuse. Look around and take note of what's happening with your older neighbors and friends. Ask questions and listen. And of course, do not be afraid to get involved or to reach out to our Adult Protective Services staff.
So it sounds like the best way to address and prevent the problem is to report it early. Thank you so much. Tim, can you tell folks how they can report adult abuse in Missouri and what they need to do to make a report?
Absolutely, Jessica. If you suspect abuse, neglect, bullying, or financial exploitation of the elderly or an adult with a disability, you can make a difference and call Missouri's toll-free adult abuse and neglect hotline at 1-800-392-0210. The hotline operates from 7 a.m. until 8 p.m., 365 days a year. Or as an alternative to calling the hotline, you can also make a report online 24/7 at health.mo.gov/abuse at your convenience. We encourage all mandated reporters to enter their reports online, allowing greater accessibility to the hotline for the public. In order to make a report, you're going to need the following information: the eligible adult's name, address, telephone number, gender, age, and general condition, the alleged perpetrator's name, address, gender, age, relationship to the eligible adult, and condition, the circumstances that led the reporter to believe that the eligible adult is being abused, neglected, or financially exploited, with as much specificity as possible. Whether the eligible adult is in imminent danger, the best time to contact the eligible adult, if he or she knows of the report, and if there is a danger to the worker going out to investigate. You'll also need the name, daytime telephone number, and relationship of the reporter to the eligible adult, the names of others with information about the situation, and if the reporter is not a mandated reporter, whether or not he or she is willing to be contacted again, and any other relevant information.
Okay, so aren't some people required to make reports in Missouri?
Yes, that's right. Although anyone who suspects that someone is being abused, neglected, or exploited can make a report, certain professionals, however, are mandated by law to report in Missouri. Some of these professionals required to report adult abuse in Missouri include law enforcement, first responders, many medical professionals, social workers, employees of some state agencies such as the Department of Health and Senior Services and the Department of Mental Health, area agencies on aging staff, and in-home service providers, owners, operators, and employees. A complete list of mandated reporting laws and mandated reporters can be found on our website, health.mo.gov/abuse. Mandated reporters, together with Adult Protective Services, play an important role in helping seniors with disabilities live lives free of abuse and neglect. For that reason, mandated reporters are required to report incidents to Adult Protective Services, and there are legal repercussions for failing to report such suspected incidents of abuse, neglect, self-neglect, and exploitation. It's also important to note that the identifying information of anyone who reports abuse, neglect, or exploitation remains confidential by state law as well.
Thank you, Tim. Jerry, can you also talk about how your unit, the Office of Special Investigations, helps to address abuse, neglect, and exploitation in Missouri?
Sure, Jessica. The Office of Special Investigations receives their investigations from the Adult Protective Services unit. Once Adult Protective Services receives a hotline report and provide any needed services, a report may be generated to the Office of Special Investigations if the APS worker has suspicion that a crime is or had been committed against one of Missouri's elder or disabled population. OSI investigates the allegation, and we will also team with local law enforcement to address the criminal allegation.
You all have provided such great information. Do you have any success stories of the department's investigations of adult abuse you can share with us today?
Jessica, there are many that I would love to share with everyone today. However, there are just a couple that I would like to highlight. All of our hotline reports, of course, are protected by confidentiality laws. So I have altered information in these stories to protect the identity of our victims. We recently worked a case in the western part of the state involving an elderly gentleman who we will call Mr. Mays. Mr. Mays, unfortunately, was gravely assaulted at the hands of his own son. He sustained multiple injuries, including a brain bleed, fractured rib, and extensive bruising. Local authorities were quick to file elder abuse charges against the son. Mr. Mays spent several days in the ICU before eventually being able to return home. Throughout the investigation, our team member worked as an advocate and collaborated with local agencies such as the prosecutor's office, hospital, the landlord, and victims advocate to ensure justice and Mr. Mays' safety. I'm happy to report that Mr. Mays is healthy and residing with his family in his community. In September of last year, we received a report concerning an older adult who had a massive stroke while driving his car, which left him unable to walk. After receiving medical care and completing rehab, Mr. Smith chose to recover at his mother's home, as she did not have any stairs that he would have to navigate. Initially, Mr. Smith's wife was going over to help care for him. However, his mom, who was also the alleged perpetrator in our case, started limiting the wife's visits and eventually wouldn't allow her to come over at all. His mother began isolating him from all of his family members, including his own grandchildren. She even took away his cell phone and monitored any calls that she did not allow him to take. This case became even more complex when one of Mr. Smith's brothers somehow became his financial power of attorney. And even though he didn't remember signing any of those documents in the hospital. During the initial phone contact with Mr. Smith's mother, she began giving our agency false information and reported that she had to protect Mr. Smith from his wife and she wasn't able to properly care for him or give him his medications. During the course of the investigation, this information was found to be false. The wife reported that almost all of their money was gone. Our APS staff made an unannounced visit to the home, and we were finally able to talk to Mr. Smith alone. He quickly told our staff that he wanted to go home, but wasn't allowed to do so. During the visit, his mother would interrupt and would not allow Mr. Smith to speak on his own behalf. We immediately started making arrangements for Mr. Smith to return home to his wife. Within just a few days, with the assistance of local law enforcement and the fire department, we were able to transfer Mr. Smith back to his home per his wishes. As soon as his wife saw him, they hugged and began sobbing. Actually, there was not even a dry eye in the house. We continued to follow up on Mr. Smith to ensure that he was being properly taken care of. He was just elated to be in his own home. These are just a couple of the stories about what we do here at APS. APS is about advocating and supporting those that we serve. These stories highlight the importance of APS and what can be accomplished when we persevere and do not give up. I'll turn it over to Jerry.
Thanks, Christy. OSI had a case where an elderly male went to reside in one of Missouri's veterans' homes. The individual had a female friend become his power of attorney, managing all of his finances. However, the female friend passed away, and when she did, her spouse became the new POA without the knowledge of the victim. Once the victim found out about the change, he allowed the suspect to be the POA, but as time went on, he became frustrated as the suspect never could produce any financial records when asked. The victim then asked a niece to be his POA, and once she was in place, found many suspicious withdrawals. She kept asking the suspect for bank cards and checkbooks, which he never would produce. A report was made to Adult Protective Services Unit, and after services were provided, a report was generated to the OSI. The investigator contacted local and law enforcement, and they also had a criminal complaint. It was decided that the investigation would be conducted jointly, with OSI being the primary. The OSI investigator was able to obtain financial statements, and with the victim was able to determine there was a total loss of approximately $77,544.50. There was a forged check written to the suspect and another male subject who appeared to be a co-conspirator on the joint account for $70,000. With this information, probable cause was developed and arrest warrants were issued for the two suspects for financial exploitation of the elderly and disabled, a Class A felony in the state of Missouri.
Wow, Tim, finally, tell us how we can promote awareness of elder abuse in our communities on World Elder Abuse Awareness Day.
Sure, there's numerous ways we can celebrate World Elder Abuse Awareness Day. First off, we can wear purple on Saturday, June 15th. Take a photo and join the conversation by posting it on social media using the hashtag #WeAdd. DHSS will be staging several photo opportunities across the state. Staff can submit photos to intranet@health.mo.gov. Photos will be posted on the DHSS Flickr account. You can also display purple pinwheels, flags, and ribbons throughout your community. Here at DHSS, we are displaying purple pinwheels along with banners and yard signs across the state. We've placed pinwheels in the ground along with banners in front of our buildings to represent the number of substantiated adult abuse reports respective to that county. You can also light up a landmark in your community purple or use a purple porch light during the month of June. You can share information about elder abuse and scam prevention. We all hear of scams all the time and they impact so many people. So share these stories so that others might not fall victim to these scams. You can call or visit an elderly friend, family member, or neighbor. Volunteer to help older adults in your community. You can also participate in a Walk for WeAdd event near you. For more information on Walk for WeAdd, go to health.mo.gov/WeAdd. And finally, report elder abuse when you witness it or become aware of it. One of the best ways we are attempting to increase public awareness of adult abuse, neglect, bullying, and exploitation is through our statewide media campaign and our partnership with our mandated reporters. We are distributing our public service announcement through media outlets this year, and we wanted to give you a preview of it now.
Hey, Dad. The pharmacy called. Sounds like you still haven't picked up your heart medication. Are you all right?
Hey, Frank, it's Sally. I got your voicemail earlier. So your nephew asked you for another loan?
It's on all of us to know the signs, and essential community services are available to help. Don't let your call go unanswered. Call APS or visit our website to learn more.
I want to thank all of our panelists for joining us today for this incredible discussion and to mark World Elder Abuse Awareness Day in Missouri and help us call attention to this global public health crisis. Before we wrap up, I just want to invite our listeners to join in on the many discussions happening in Missouri surrounding elder abuse as we continue to lead the way to ensure older adults live a safe and healthy life free from abuse, neglect, and exploitation. For more information on World Elder Abuse Awareness Day events, webinars, and materials to share within your communities, please visit www.health.mo.gov. As the leader in promoting, partnering, and protecting the health of Missouri citizens, the Department of Health and Senior Services encourages those who are qualified to help educate our communities, organizations, businesses, and individuals about elder abuse. Thank you. And now a short message from our Lieutenant Governor, Mike Kehoe, Missouri's senior advocate.
Since 2006, June 15th has been designated as World Elder Abuse Awareness Day, a day that recognizes the significance of elder abuse as a public health and human rights issue. No community is immune from the mistreatment of older adults. Seniors and people with disabilities may be socially isolated and physically dependent on the perpetrator, often a son, a daughter, or other family caregiver, making it a complex and difficult situation to report. The Department of Health and Senior Services and I invite you to join us in building strong support for elders for World Elder Abuse Awareness Day. If you suspect someone who is elderly or has disabilities is being abused, neglected, or financially exploited, report it to the Adult Abuse and Neglect Hotline at the link and number you see here on the screen.